During the T-lift procedure, the patient lies face down on a bed designed especially for the procedure. Through an incision on your back, the surgeon begins by accessing the section of the spine that needs to be fused. First, any bone spurs and disc material pressing on the nerve is removed, and the opening around the nerve enlarged. Then the surgeon will remove almost the entire disc between the vertebrae to create a clean space for fusion between the bones. If the disc has collapsed from disease, the vertebrae are moved back into a normal position. The surgeon then prepares the area where the disc was removed so that the spinal implant can be placed for support. After measuring the size of the space, the surgeon inserts an implant made of bone or a synthetic material into the disc space. This implant gives critical support to the spine and aids bone fusion. The surgeon then places bone graft or other special material into the space around the implant to stimulate bone growth, which will take several months. Then, on the back part of the vertebrae, small screws called pedicle screws are inserted into the bone, and connecting rods are inserted into the screws to give the spine extra stability. This holds everything in place as it heals and allows for more activities after surgery. Over time, the vertebrae will grow together or fuse. After surgery, patients typically stay in the hospital 3 to 5 days. While pain varies a few weeks after surgery, you should expect major soreness in your back for the first several days. If the doctor uses bone from the pelvis for the bone graft, you'll also feel soreness in your hip area. Pain is managed with medication for 2 to 4 weeks, and rehabilitation begins in the hospital. A physical therapist will help you get out of bed and walk safely around the hospital. The first couple of days after surgery, patients usually need a walker, and a back brace may also be used when moving. It's important to keep an eye on that incision. If it becomes red, tender, or if there's drainage, alert your doctor. Some minor leg numbness or discomfort is common for a few days, but let your doctor know if it's severe or lasts more than 1 or 2 weeks. During recovery, you will need to limit your activities. Walking will help with healing, but you'll need to avoid heavy housework. You can use ice packs.